Hello, Wilma Well family. I hope everybody's doing good. This is Margaret, and today I'm going to talk about stroke or cardiovascular accident. This has been a disease that has been taking so many young people and is the highest medical uh, condition that increase risk of disability in young and adults. So having a stroke doesn't mean that you have to be old. You can be a young person and you have stroke. So this is a medical emergency. So you want to make sure that if you notice your loved one has a stroke, you want to make sure that you look for signs and symptoms of stroke. What are the things that you're going to look for? Because when you have a stroke, which means that this condition can cause by lack of blood supply in part of your brain, and therefore you might have side of the face drooping or feeling numb. So when you ask your loved one to smile and they smile and they're like facial drooping, they can't smile straight, that can indicate somebody having a stroke. Speech, that's another thing that you want to look for. Are they having difficulty of speaking? Can they verbalize anything? Weakness in one side of the body, are they having any weakness in one side of the body? So those are the things that we need to watch for. And the sign of symptoms, we use the term called FAST. We use FAST, FAST. FAST means face. Look at their face. A means stand for arms. Are they having if they raise their hands up, is their hands equal? Is it one hand able to raise it up or not? And speech, you gotta look for speech, which is S, and then you look for time. Is very crucial when somebody is having a stroke. The time is very crucial. If you notice your loved one is having a stroke, you have to look for those signs of stroke and then call 911. Again, 911, because you can save lives by taking fast action. That's number one. Because when somebody, you have like a 3 hour window from the time they have a stroke to then when they get to the hospital. So they have to do some testing and see if they give them what they call a clot buster, what they call a TPA. So that one can be given if this patient has a stroke within at least 3 hour window. It was rescued by the loved one or they have it at home or in a hospital. If they have this stroke within 3 hour window, you want to make sure they do testing, and if they can do that, can they qualify to get this TPA? So those are the things that we look for. Time is very important for stroke. Call 911 right away. Again, CPR, you gotta know how to do CPR. Your loved one, your kids need to learn how to do CPR, because you never know. My mom was having cardiac arrest, so we're able to call 911 at the same time we have to start CPR. She was able to we were able to sustain her until the CPR people came in, the ambulance came in, and they took over. So CPR is very important. It's a good thing to learn as loved one, because sometimes the hospital might be far. Sometimes the medical emergency might not get there on time. But if you have your CPR, your kids, your mature adult or mature kids or your adult have a CPR, is very crucial when it comes to this emergency. Remember, every minute count with a stroke. We gotta make sure that these people get attention quick. What are the so there are causes of stroke? So stroke can be there are two main causes of stroke. Can be a blockage, blocked artery, or ischemic stroke, or leaking or bursting of blood vessels, which is hemorrhagic stroke. So somebody can have blockage, can be plaque built up, go to your brain and block the oxygen supply, and that can cause a stroke, because your body, that part of the brain is dead, no oxygen going, so that can affect your loved one. Or hemorrhagic stroke, what about if this plaque go and burst and now it start leaking or busting blood vessel. It can burst blood, we call hemorrhagic. So hemorrhagic, you're bleeding in your brain. Very crucial, guys. And so this is very, very important. So some people may have only temporary disruption of blood flow to the brain, known as transient ischemic attack or TIA. That doesn't cause lasting symptoms. So when somebody say, "Oh, I have a mini stroke," which means they have a little bit, some kind of a little bit less supply of blood in that part of the brain, or TIA, so that at least they can regain that part of their body. But when you have full-blown stroke, is increased risk for disability, and some people don't get to work up again or talk at all. So again, we have to be aware of this disease because there are so many people that have been going through this disease, stroke, and we lost our loved one from a stroke, and also young people are dying from stroke, or they are having stroke at age of 30s, age of 40, 50s. And so we just have to be aware of this. And so we have to know what are the risk factors. What are the things that can cause a risk factor that can increase your risk for having a stroke? There's some lifestyle risk factor, that things that you can change, like being overweight or obese. Those are things that you can change. They can put your risk for stroke. Or physical inactivity, you're not exercising. Heavy binge drinking, you're drinking, things like that. Or you use illegal drugs such as cocaine and methamphetamine. So those are the things that lifestyle risk factors. And also, we also have medical risk factors. What are the medical risk factors that can cause stroke? The medical risk factor that can cause stroke are things like high blood pressure. So high blood pressure can cause stroke. High blood pressure can cause stroke. Cigarette smoking or secondhand smoke exposure. If you are around someone that's smoking, you can increase risk of having stroke. And what about cholesterol? Those are the medical risk factor that can increase your risk of having a stroke. Diabetes or obstructive sleep apnea. So those are the things that can cause stroke. What about cardiovascular disease, including heart failure, somebody having heart defect, or heart infection, or irregular heartbeat, such as arterial fibrillation, because your heart is quivering, it's not pumping right. So those are the things that can cause risk of stroke. And family or personal history of stroke. If somebody already have a stroke, or they have heart attack or TIA, they can also increase risk for having another stroke. COVID-19 infection, people who have COVID-19 infection, they can increase risk for having stroke, because when you have COVID, it can cause what they call inflammation of your heart muscle, and that inflammation can end up causing stroke. So yes, somebody who have a COVID-19 can increase the chance of having a stroke. And so we have also other factors that can increase your risk of having stroke. Things like age, people who are older than 55 and older can increase risk for stroke. Race or ethnicity. According to the study, we have seen African American and Hispanic have high risk of having stroke. So do people of other race or ethnicity, can being a different ethnicity can increase your risk of having stroke. Sex. Men have higher risk of stroke than women. So gender, that we're talking about gender. When I say sex, is gender, male or female. So the study has shown that male have higher risk of having stroke than women. Women are usually older when they have stroke. They are more likely to die of stroke than are men. I don't know why. I think because of the age, because since they're having stroke at since women are having stroke at older age, they're likely to die than men, because let's say men have a stroke at the age of 30 or 40 or 50, they are still young. They can struggle, they can fight any kind of disease or infection or whatever stroke. But when you are 80 years old female or 90-year-old female, your immune system is not strong as a 50-year-old male. So that's why when women have a stroke, because they have it at old age, they tend to die from it compared to young men, which is compared to men who are having stroke at early age where they're young, they can fight it. So those are the things that can increase your risk of having stroke. And so we have complication of stroke. What are the complication of stroke? When you hear your loved one have a stroke, what are the complication you expect to have or they have after the stroke? The main one is paralysis or loss of muscle movement. People be paralyzed. You can paralyze one side of your body. You can paralyze both sides depending on what kind of stroke you have. So that is the one side body paralysis, or you lose control of a certain muscle, such as those on your side of your face or one arm. So you end up, people have like one arm will become paralyzed compared to the other one. Another complication of stroke and can be difficult talking or swallowing. People have difficult talking or swallowing when after the stroke, if they have a severe complication. I remember my mom had a cardiac arrest, end up having stroke, and she was not able to talk again. So it is a life sentence depending on what kind of stroke you're getting. So she was not able to swallow. So we have to do what they call the tube feeding, and also we have to have her on tracheostomy. So those are the things that some with complication that you can get when you have a stroke. Memory loss. Another complication is memory loss of thinking, disabilities, so difficulty. So you might have complication of memory loss, thinking, or difficulty thinking. Example again, my mom, when she had a stroke cardiac arrest, she ended up losing her memory, thinking. She didn't talk for 7 months. She passed on. So those are the complications that can occur when somebody have a stroke. Emotional problem. People who had a stroke may have more difficult controlling their emotions, or they may develop depression. So let's say you have a stroke and maybe you are having difficult talking, and so, or difficult walking. Let's say you are a person that was able to move and do things on your own, but after the stroke you can't do those things anymore. So that can affect you, can cause you have depression and anxiety and anger issues. So those are the complications that somebody can have after the stroke. Pain. People might have pain or numbness on one side of their body. For example, if a stroke causes you to lose feeling in left arm, you may develop an uncomfortable tingling sensation in that arm. So again, pain can happen. They can have pain after the stroke. Another complication is changes in the behavior and self-care disability. So these people, after the stroke, you might not be able to take care of yourself. Your behavior might change. People who had a stroke may become more withdrawn. They may need help with grooming and daily chores, because remember, this is a person that was able to take care of themselves, and then after the stroke they cannot take care of themselves. So you might have some behavior changes and self-care ability, so you might not be able to take care of yourself. And it's not easy. It put pressure on a family member, because when your loved one cannot do things on their own, so they become your full responsibility, and it is not easy, guys. I'm telling you, because I went through it. My mama had a cardiac arrest which resulted to stroke, and it was not easy. It was difficult mentally, physically, financially for me, for my family, for my siblings, for everybody around my mom at that moment. It was not easy after the stroke. So it is not a easy task. So our goal is to prevent. So how can we prevent stroke? How can we prevent those stroke risk factors, things like blood pressure and all that stuff? So, in order to prevent stroke, we have to be able to control high blood pressure. If your doctor told you have high blood pressure, be able to control that. You can lose weight, you can exercise, you can change your lifestyle, you can eat healthy, you can take your medication to lower your blood pressure. So those are the things that can help control your blood pressure so you don't have a stroke. Cholesterol, if you lose weight, exercise, eating healthy, and taking care of yourself, you can lower your cholesterol. Your cholesterol can go down just like that by just changing what you eat, exercising, and losing weight. Those are the things that can help. And also, if you have a prescription, you take your prescription. They use statin medication. Those you can use them to help. I know I remember my mama was taking cholesterol medicine and she said, oh, my body was aching, so she didn't want to take it off and on. So anyway, so those are the things. If you cannot take your medication because of the side effect, you want to talk to your doctor, or you want to do something to prevent you from having this cholesterol. Exercise, eating healthy, just change your lifestyle in general in order to be healthy. Quitting tobacco use. If you're a smoker, you gotta quit that tobacco, because tobacco has very high risk factor of cardiovascular risk factor, cancer risk factor, stroke risk factor. So you have to stop smoking and quit smoking. Even a second and smoke. You wanna, people, somebody might be smoking. If you have a loved one who's smoking and you don't smoke, and they'll ask you, do you mind if I smoking? And you don't say yes, because it is not good for you. Remember, even though you are second in smoker, you can still increase your risk factor of having stroke and cardiovascular disease or other diseases that can affect your health. If you're diabetic, be able to manage your diabetic, be able to manage the blood sugar. And again, lifestyle changes, lower the blood sugar. If you have to take medication, so be it. So check with your doctor, be able to control all that stuff. Maintaining your healthy weight, overweight, gotta lose that weight, guys. Um, you want to eat diet rich in fruit and vegetables. Fruit and vegetable has high amount of nutrients, and also they're healthy for your body. They may reduce risk for stroke. And for example, you can use Mediterranean diet, or things like plant-based diets. All those, just in general, vegetables and fruits can help lower your risk of having stroke. Um, you gotta exercise regularly. It's not about I exercise today and I don't exercise tomorrow, or because I lost weight, I don't want to exercise anymore. You gotta do this continuously. You want a blood pumping in your body, in your heart, every single time. So you gotta do exercise regularly. So that can help. You can do walking, jogging, swimming, bicycling, or whatever you have to do. You want to make sure that you do exercise. Very good for you. It helps to lower your cholesterol, help to lower your blood pressure, and also it helps to relax you, and also to help you sleep well. So those are the things that exercise can help. And exercise also can help with depression. So there are so many things that exercise can help besides stroke. If you are drinking alcohol, you gotta slow down. Moderation. You gotta moderate. If you love your alcohol, you gotta lower the intake of the alcohol. Remember, your health is in your hand, and it's not in your mama's hand or your daddy's hand or your siblings' hand. It's in your hand. It's in my hand. So I have to be responsible to stop drinking alcohol, if I was drinking, I gotta lower that intake of alcohol. And because alcohol can increase risk for high blood pressure and stroke, hemorrhagic stroke, and ischemic stroke. So also alcohol also can interact with other drug that you're taking, like high blood pressure medication, other medication can interact with alcohol. Another thing you can watch on your treating your OSA, which is obstructive sleep apnea. So if you have obstructive sleep apnea where you snoring at night, sometimes you stop, you're not, you can't breathe well because you're overweight and you're eating so much junk food and things like that, you may want to see your doctor, be able to control that, because studies, your doctor may recommend a sleep study if you have symptoms of obstructive sleep apnea. Sleep disorder that causes this is a sleep disorder that causes you to stop breathing or short period of repeating during sleep. You can breathe during sleep. Treatment of OSA, which is obstructive sleep apnea, can be include a device that deliver positive airway pressure, the CPAP or BiPAP, things like that. So help to open your airway. So those are the things that you want to talk to your doctor about if you're having difficult problem with the obstructive sleep apnea, snoring at night, having this OSA. Avoid illegal drugs, street drugs such as cocaine, methamphetamine. They are established risk factor for TIA or mini stroke or the main stroke. So those are the things that we have to be able to do in order to prevent those the complication or stroke from happening. And we also have medication. So there are medication that you can take for blood cholesterol, for preventive medication that you can take for stroke can be antiplatelet drugs such as blood clot antiplatelet drugs such as Plavix. The doctor might put on Plavix, aspirin, and that can help you so you don't have a blood clot, or your blood don't clogged up together. And they can also give you anticoagulant drugs such as Coumadin or Eliquis. Those are the drugs that they can give you, Xarelto, Eliquis, and also Pradaxa. Those are the drugs that you can take to lower the risk of having a blood clot. They are blood thinner, they'll thin your blood so you don't have clot that can cause stroke. And heparin, mostly heparin is short term, they give you when you're in a hospital. So that one can be given when you're in a hospital. So again, I hope this will help us learn about the risk factor and causes of stroke and what can we do to prevent that. I hope this will help, guys. We gotta be watchful. Young people are dying from stroke nowadays, so we just want to make sure that we don't lose our loved one. We try to do a level base, and at the same time we help reduce the cost of healthcare that is when you have a stroke, there's so much money going in to take care of one person, so you really don't want money, time, and all that stuff, because when your loved one is sick, you got to be responsible for them, and that's take your life away from everything else, for you, from your own family, from everything. It happened to me. My mom was sick for 7 months, and I was there taking care of her 24/7. So it was not easy financially, mentally, physically. But if we can prevent these causes of a stroke or cardiac arrest or whatever it is, we can help reduce or prevent us from getting the stroke in the first place. For my young ladies, another risk factor for stroke is reproductive pills, all those medication that prevent you from having children, which is contraceptive, they are very high risk for stroke. So you need to talk to your doctor, or if you have a risk, you have like a family history of blood clots or stroke, you want to make sure you talk to your doctor before you start taking any birth control pills. And I hope this helped, guys, so we can prevent this disease or this condition. And thank you very much for listening to me. Share this information, hit the notification bell, and subscribe to my channel so we can produce more videos. And stay blessed. Margaret, your wellness coach. Bye.